Good morning, my name is Elizabeth. I'm a physical therapist assistant student at NWTC. How are you doing today?
I'm doing fine, thank you.
All right, can I get you to verify your name and date of birth?
I'm Betty Boop and I'm 7659.
All right, Betty Boop. This is Lucy. She's going to be assisting with our treatments today. So it sounds like you're having some knee pain, correct?
Correct.
All right, so plan of care from the PT is that we're going to use the IFC machine. It is an interferential current unit. It uses polyphasic sinusoidal electricity waves to penetrate the skin and kind of give you some pain relief, okay?
Okay.
Do I have your consent to do this treatment on you?
Yes.
Okay. Before we begin, I'm going to go over some contraindications with you. Make sure you're safe to do this treatment. Do you have a pacemaker?
No.
Do you have an implanted stimulator of any sort?
No.
Do you have any superficial implants of metal in the knee area? No?
No.
Okay, are you pregnant?
No.
You're not disoriented today?
No.
Okay. We aren't going to be doing any contractions, but you are able to do some light contraction in the area.
Okay.
Yeah.
Yeah.
Okay. You're not bleeding?
No.
Do you have any malignancies?
No.
No? Okay. I think that is it. Oh, and we're not treating the anterior triangle because this is your knee, obviously. Okay, so I'm just going to do an initial assessment of the area. Looking down at your knee, you can see that you have a surgical site. I'm going to compare to your other knee. We might see some edema after surgery. Palpating, skin is intact, wound is healing. You said you have pain on a scale of 1 to 10. What's your pain at?
5.
At a 5? Okay. We can say we did some range of motion, manual muscle testing, documenting that. Okay?
Mm-hmm. Okay.
All right. So I'm going to be doing a sensation test. First, I want you to let me know which is more pressure, 1 or 2, with your eyes closed.
Okay.
1 or 2?
1.
1 or 2?
1.
1 or 2?
2.
Okay, keep your eyes closed. We're going to be doing temperature sensation. Tell me which one's colder. 1 or 2?
2.
1 or 2?
2.
1 or 2?
1.
Okay. You passed. You can open your eyes. So now we're going to go ahead with treatment. When I'm doing the IFC, my first set of electrodes, I'm just going to crisscross over the area. Now you said that your pain is along your incision site, correct? You said your pain was along the incision site,
yes.
Correct? Okay, so that's a vertical, so we'll be doing a vertical vector. First I'm going to be doing an alcohol wipe, though. So we're alcohol wiping the skin area. Okay, so we're placing the first set of electrodes. So this is my white, and this is my red. Now to get a vertical, I'm going to be separating the colors. So my other one, I'm going to be doing a red on the side and a white on the other if you want to do a, so that you can see. I've got it, the vertical vector that is separated by the colors. So now I'm going to boot up my machine here. So I'm coming to the first screen. The first screen I'm going to pick wave. Maybe. Pick up. There we are. Alright, so then because this is the polyphasic sinusoidal, we'll be picking the butterfly setting. After the butterfly setting, we're going to be picking continuous. We'll do a treatment time of about 10 minutes. So I'll pick 10. Since this is an acute injury, we'll be doing 80 to 150 pulse per second, but if it were chronic, we could do 2 to 10. We're going to be picking medium depth If she had more musculature in the area, we could pick deep, or if it were over a lot more bones, she were really not having a lot of musculature, we could pick shallow, but we'll just do medium. For vector speed, we'll pick normal because we want it to stay static along the incision line. If she were having radiating pain either to the left or the right, we could pick slow or fast. And now we would set intensity. So Betty, what we're going to do is I'm going to start turning up the intensity of the IFC unit. I want you to let me know when you feel a comfortable tingle, something that kind of relieves your pain. We're not looking for a muscle contraction here, okay? All right, so I'm turning up. Turning it up.
Okay.
That's a comfortable? Okay. So what I'm going to do then is I'm going to kind of let you feel it for a couple seconds, and then I'm going to ask you, do you feel like the tingle is evenly balanced amongst the electrodes? Or do you feel like it's heavier on one side or pulling to a different side?
That's the same.
It feels pretty balanced. If it wasn't balanced, we would go back into the IFC machine and we would press the balance button, and then I could adjust the electrodes that are emitting the current and kind of even out how she's feeling the current, the treatment. So what I'll do is we set you for 10 minutes. I will set my timer here for 5 minutes. I'll come back and I'll check you. Do you have your call bell? Hold on, let me get you a call bell. Here's your call bell. Mom, do you even have the camera on me?
No.
Okay. Ring ding ding, it's been 5 minutes. Are you still doing okay?
I'm doing fine, thank you.
Okay. So I'm going to leave you for another 5 minutes. You have your call bell if you need me. So then what we'll do is 5 minutes goes by, 5 minutes comes up. All right, so I'm going to stop the machine. How are we feeling?
We're feeling fine.
We're feeling fine. Okay, how is your pain?
Feels good.
Okay, so I would do a final once over of the big 7, looking at the skin. Nothing was irritated with the electrodes. Edema still kind of there because of the surgery. Palpating the skin, normal temperatures, normal coloring. We could say we did a little bit more range of motion, manual muscle testing, and I compared to the other knee. And then I would let patient either continue with other treatments or go on with their day. I would then document that we did IFC treatment with a vertical vector along the left knee incision site according to the specific parameters for acute conditions. Patient was positioned long sit, and patient tolerated treatment well. That is the end of my treatment.